Hi everybody, I'm Dragon Borner. Welcome back to Surgeon Squad. Now, the reason I'm coming back to this is because I watched one of the surgery videos and I never ever did dental crown surgery. So I thought, you know what, I've got a spare half an hour, so I'm going to do a few recordings today. Well, this evening. It's 4:45 already. So let's begin. So this is dental crown surgery. Now, I've never done this, and I'm gonna see what it's like because I actually don't know how they do it. So,
welcome to Surgery Squad's virtual dental crown. I'm Dr. Jeff, and I'll be assisting you with this procedure today.
Cool.
A dental crown is a tooth-shaped cap that is used not only to restore the strength and functionality of a tooth, but can also improve its overall appearance. Before we begin, let's review the types of crowns used in dentistry. First up, temporary crowns. Temporary crowns are placed over a patient's tooth while they wait for their permanent crown. They're usually prefabricated and made of plastic or stainless steel. A patient's permanent crown can be all metal, porcelain fused to metal, all porcelain.
I do apologise as well, I have got a cough, that's why I haven't been bothering about doing recordings, so I do apologise. That's why I've not just done trucks and weights and that's it, just left it again. So I am back, but I have got this slight, stupid, pathetic, petty cough. So.
Or all ceramic, each with their own advantages and disadvantages. Click on the different types of crowns to learn more about them. When you're ready to move on, click the continue button.
Wicked. My phone is working, so. All metals.
The metals that are used in all metal crowns include gold, palladium, nickel, or chromium alloys. While all metal crowns require less tooth structure to be removed and have increased durability, they don't have a tooth-colored appearance. Unlike metal crowns, porcelain fused to metal crowns can be matched to the color of your teeth. Unfortunately, the underlying metal may show through at the gum line, and the porcelain could chip off over time. All porcelain or all ceramic crowns have the closest appearance of a natural tooth and may be ideal for those with metal allergies. However, they have slightly less durability than porcelain fused to metal crowns, and because they require more preparation, they can be a bit more expensive than other types of crowns.
Wicked. That one. Yeah. So
our patient came in today with a broken tooth, courtesy of a freak softball accident. And we get the rewarding task of placing a crown in.
Epic.
If you haven't noticed already, it's one of their lower front teeth, tooth 23. Let's review what we're going to do today. To begin, we'll numb the tooth, then shape it, take impressions for our dental lab, place a temporary crown, and determine the shade of the tooth. When our patient returns for their next appointment, we'll place their permanent crown. Now, let's put on our gloves and get down to business.
I ain't got no gloves, so I can't, so I'm going in.
First, place some topical numbing gel on the injection site.
Yo, got it,
this will alleviate any pain or discomfort the needle may cause.
I've missed this, you know. I've missed doing this. I've been watching my old videos, by the way. That's what's made me do this. I've missed this big style.
Now we need to inject the local anesthetic.
Let's inject
After it has taken effect, the area around the tooth and the patient's lower lip should be numb for a few hours.
Wicked.
Inject the local anesthetic into the patient's gums, just below the tooth we'll be working on.
Just below. Numb the tongue instead. Puff! Straight in. Look,
let's wait a few minutes to allow the anesthetic to set in.
I'm a man now, so I can take all this shit.
Now that the area has become completely numb, we can move on to preparing the tooth. To begin, we'll reduce the size of the tooth, cutting it away from the adjacent teeth. Go ahead, give it a try.
Listen, have we checked? Have we checked that he's numb? Have we punched him? We've got to punch a few times, but it's all that. Epic sound effect. close, so it's not going to gap basically into the teeth. Good idea. I'm going to do this, by the way. That's what's about this.
It looks good, but we need to create a more tapered top to the tooth. This will allow for a more comfortable and exact fit for both the temporary and permanent crowns.
Yo, got it, bruh. The top bit. Very good. Now you know the tooth.
That'll do.
You know the tooth now. I know it sounds stupid, like. I would just have it like that, than have a porcelain. I'd say just sharpen it, please, so it's better for me walk on my tear meat apart, if you know what I mean. I think like that, me. In fact, I'd tell them to the other side, the same, so they don't look like the odd one out. But that's just me.
Now that the tooth has been shaped, we'll need to take impressions of our patient's teeth. This is done by placing impression trays into the mouth and having the patient bite down on them. These trays are filled with a putty-like substance that is generally referred to as impression material. The impression material is used to create a plaster cast and is then sent to our dental lab, where a dental technician will make the patient's permanent crown.
Yeah, man.
Go ahead and make the impressions of our patient's teeth. When you're done, I'll have my dental assistant create the plaster cast and send it to the lab, where the magic happens.
Now this tastes like chocolate cake in one of the last videos, if I remember. So when I said bite, you bite it. Bite it.
Excellent work.
Wicked.
My dental assistant just informed me that our patient would like an all-porcelain crown on the tooth. So before we can finish up with them for the day, we need to determine the shade of porcelain that resembles their natural teeth. Can you handle this?
No. Oh, here we go. Here we go. Right. Is it that one? Or that one? I vote that one.
That looks like a match.
Oh,
the last item on today's agenda is to place the temporary crown. The temporary crowns that we use are prefabricated and made of plastic. I've already lined the inside of the crown with the temporary cement, so go ahead and place it on the prepared tooth.
Sorry about people.
Since it's only a temporary crown, there are some guidelines our patient will need to be aware of before they go. They need to avoid sticky and hard foods. Try not to chew using the temporary crown, and steer clear of flossing on either side of the temporary crown. By flossing around the temporary crown, our patient may unintentionally pull the crown off the tooth. Well, we've done all we can do today. Our patient will need to come back in a week to have their permanent crown placed.
1 week later. Yay.
Welcome back. Our patient has returned and is ready to have their permanent crown put on. Begin by using the dental hemostat to remove the temporary crown that we placed on the tooth last week.
It's that one, isn't it? I mean, it's literally that one, isn't it? I'm joking, I know. More sweet chuffy.
Now use the Explorer to remove any excess temporary cement and debris.
Couldn't you just use a polisher? Really? You had to scrape it?
I've already checked the fit and color of the permanent crown, and everything seems great. I've applied cement on the inside of the crown, so it's ready for you to place.
Yo, got it, bruh.
Perfect. After the cement has hardened, the dentist would check the fit of the crown again, and the patient's bite, to ensure that there are no issues. Luckily for our patient, you did a marvelous job. After placing the permanent crown, our patient may notice some mild sensitivity for the first hour. Their dentist will also offer them some post-case recommendations to follow before they leave. This includes waiting at least an hour before having anything to eat or drink, and waiting 24 hours before enjoying their favorite sticky or chewy foods. If our patient has any pain or sensitivity when they bite down, they should contact their dentist immediately. This may indicate that the crown is too high on the tooth and needs to be adjusted. Most dental crowns last anywhere between 5 and 15 years, depending on normal wear and tear, oral hygiene habits, and other behaviors, such as teeth grinding, chewing ice, or biting your fingernails.
What would you chew ice for?
Well, I hope you've enjoyed placing a dental crown. Maybe you should consider a career in dentistry. While you're at it, check out other great surgeries here at surgerysquad.com.
It's like what I said to my old videos, you're going to come on down to my house and I'll do dental surgery for you. But anyway, that's that. I hope you enjoyed it. But this is it for now, for dental surgery. I'm not going to do what I did many months ago, about 6 months ago. Did about 20 different surgeries. And the other 10 got shown because the other 10 from Orco got destroyed. By me forgetting to put microphone on, my old microphone on. Which this is on anyway. When it comes up, now I've got it now to come up now. If microphone's not turned on, it'll come up saying, speak louder. Anyway, thank you for watching. Click this to watch on the screen inside more what I've done. As well as I'll see all of you in the next episode. Bye bye.